เชิญนะครับ
Distinguished guests, ladies and gentlemen, the event will start in a few minutes. May I invite you to please take your seats. Thank you. เรียนแขกผู้มีเกียรติทุกท่านคะงานจะเริ่มต้นในอีกไม่กี่นาทีข้างหน้าขอเรียนเชิญทุกท่านโปรดนั่งประจำที่ค่ะขอบคุณค่ะ Your Excellency, Mr. Siyasak Phongketkaew, Minister of Foreign Affairs of Thailand, Dr. Sopon Iamsiri Thawon, Deputy Permanent Secretary of the Ministry of Public Health, Excellencies, distinguished guests, ladies and gentlemen. Good afternoon and a very warm welcome to the International Universal Health Coverage Day 2025 event under the theme Sustaining Universal Health Coverage, Global Governance and Local Effort. The event is co-hosted by the Ministry of Foreign Affairs of Thailand and the National Health Security Office with cooperation from the Ministry of Public Health and the Thai Health Promotion Foundation to raise awareness on the importance of sustainable health systems and access to health services and to promote knowledge exchange on how to sustain UHC, especially in light of the current global health context. My name is Natasha Isarapakdi from the Department of International Organizations, and it is my honor to be your MC this afternoon. Before we begin our event, please allow me to briefly introduce today's program. We are honored to have His Excellency Mr. Siyasak Phongketkaew, Minister of Foreign Affairs, to deliver the welcoming remarks. This will be followed by remarks from Dr. Sopon Iamsiri Thawon, Deputy Permanent Secretary of the Ministry of Public Health, and afterwards there will be a group photo session. Following the photo session, we invite our guests to spend some time exploring the exhibitions in the hall outside, organized by the National Health Security Office and the Thailand Center of Excellence for Life Sciences. We will then begin our panel discussions back in this room, and the first one will be on global to national governance for sustainable UHC. This will be followed by our second panel discussion on shared responsibility, multi-stakeholder approaches to sustaining UHC. And lastly, Ms. Pinsuda Chayanam, Director General of the Department of International Organizations, will be giving the closing remarks. Now, without further ado, may I invite His Excellency, Mr. Siyasak Phongketkaew, Minister of Foreign Affairs, to deliver his welcoming remarks.
Excellencies, distinguished guests, ladies and gentlemen, the Constitution of the World Health Organization affirms that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being. This is a reminder that health is a human right, not a privilege, not a benefit for a few, but the right of all. This is the idea that stands at the heart of universal health coverage, for which we are gathering today. And that is why Thailand has long championed UHC and the need for strong, resilient health systems. Back in 2017, when Thailand chaired the Foreign Policy and Global Health Initiative, we worked with partners to push forward the UN resolution that established the International WHC Day on 12th December of every year. Today, 8 years on, we gather to reaffirm our commitment to advance global health policies and highlight the importance of access to affordable and quality health services for all. Our theme this year, Sustaining Universal Health Coverage, Global Governance and Local Effort, captures the task before us. It reminds us that good policy must connect what happens at the global level with the realities people face every day. Excellencies, ladies and gentlemen, the truth is sustaining WHC has become more challenging. We have seen cuts to development and humanitarian funding, including for health. We face complex geopolitical tensions. Demographic change is reshaping healthcare demand. Non-communicable diseases continue to rise. And climate change is already affecting health more than many expected. These pressures are not isolated. They reinforce one another, and they place heavy strain on health systems everywhere, Thailand included. If we do not act, progress that took decades to be reversed can be reversed in just a few years. That's why today's discussion is so important. We need to look honestly at what the global health architecture now looks like, how global governance and financing shape national priorities, and what we must do together to ensure that UHC remains viable, sustainable, and people-centered. At the same time, solutions cannot come only from policy tables. They must come from communities. The exhibition outside this hall showcases Thailand's own local innovation under the UHC scheme. There are practical examples of how local ideas can strengthen national resilience. And none of this would be possible without the people who drive these efforts. So let me thank all the panelists, moderators, and exhibitors representing government agencies, international organizations, academia, the private sector, youth, and civil society. Your contribution will enrich today's discussion and help ensure that UHC continues to evolve in service of our people. A special word of appreciation also goes to the National Health Security Office, the Ministry of Public Health, and Thai Health. Your continued partnership has been vital to Thailand's health diplomacy and to the progress we have made in strengthening UHC over the years. Excellencies, ladies and gentlemen, one message I want to stress today is that global health and foreign policy are inseparable. The forces shaping health outcomes, conflict, climate change, economic shocks, technology, do not stop at any border. And because the challenges are interconnected and our responses must be as well. My hope is that today's dialogue will spark new ideas, new partnerships, and new resolve. Ultimately, sustaining the UHC is not only a technical challenge, it is a collective responsibility. It is a promise we make to our people that everyone, everywhere, has the chance to live a healthy and dignified life. I wish you all a fruitful and constructive discussions ahead. Thank you very much. ขอบคุณครับ
Thank you, Excellency, for your inspiring remarks. And now, I would like to invite Dr. Sopon Iamsiri Thawan, Deputy Permanent Secretary of the Ministry of Public Health, to deliver his remarks.
สวัสดีครับ His Excellency Mr. ศรีอาศักดิ์พวงเกตแก้ว Minister of Foreign Affairs of Thailand Excellency, Honorable guests, ladies and gentlemen, on behalf of Thailand's Ministry of Public Health, it is my great honor to join you today in celebrating International Universal Health Coverage Day. This year's theme of Sustaining Universal Health Coverage, Global Governance and local effort remind us that the sustainability of the UHC depends on the international interaction between global commitment and the strong local action. Thailand's journeys toward universal health coverage span more than 2 decades, grounded in the belief that all people should receive essential health care without financial hardship. Through our 3 public schemes, the Civil Servant Medical Benefit Scheme, the Social Security Scheme, and the Universal Coverage Scheme, we have built a healthcare system that reduces catastrophic health spending and achieve better health outcomes. Our achievements are based on several factors, such as strong primary health care with millions of village health volunteers around the country, comprehensive benefit package, the high level of financial risk protection. However, we stand at a new crossroads: aging society, rising burdens of the NCD, emerging infectious diseases, and rapidly evolving technologies are reshaping the health landscape. The expectations of our people are also changing, demanding seamless care, digital health access, and greater responsiveness across all sectors. As global health governance evolves, Thailand recognizes the importance of aligning national strategy with the global reforms. Of course, sustaining UHC requires more than alignment. It demands strong political commitments as well as practical actions within our own healthcare system. The effective financial management, strengthening primary healthcare and community-based services, including enhancing the village health volunteer capacity, all remains critical to system resilience and UHC sustainability. We must also accelerate digital transformation and innovation. The digital health integrated data system, telemedicine, and AI-supported tools will help us manage rising chronic diseases, improve service quality, and reach out to more underserved population. Ladies and gentlemen, UHC is not the achievement of a single institution, but the outcome of the unity and the strong collaboration among the government agencies, healthcare providers, civil society, academia, and communities. On this International UHC Day, Thailand's Ministry of Public Health reaffirms our commitment to working with all partners to sustain Thailand's UHC for future generations. Together, by connecting global governance with local action, we can build a stronger, more equitable, and sustainable UHC system for everyone in Thailand. Thank you very much. ขอบคุณครับ
Thank you, Dr. Sopon. May I kindly ask you to remain on stage for the photo session. For the next photo session, I'd like to inform that we will be taking 2 shots in total. The first one will include His Excellency Foreign Minister Sihasak Phongketkaew and Dr. Sopon Iamsirithavorn. And our second shot will also include excellencies and distinguished guests from our partners. May I invite His Excellency Foreign Minister Sihasak Phongketkaew to the stage for the first group photo. Okay. Thank you. Please remain on the stage for the next group photo. For the second group photo, I would like to invite all our distinguished panelists and moderators to the stage, as well as the following excellencies and distinguished guests: His Excellency Mr. Saran Charoensuwan, Secretary to the Minister of Foreign Affairs, Mr. เชษฐพันธ์ มากสัมพันธ์ Deputy Permanent Secretary for Foreign Affairs, Ms. Prinsula Chayanam, Director General of the Department of International Organizations, Dr. Veerapan Lee Thanakul, Deputy Secretary General of the National Health Security Office, and Dr. Shawetsan Namwat, Director of the Health System Development Section of Thai Health, joining as the representative of the Thai Health CEO. Thank you, Excellencies and distinguished guests. I would like to now invite all of you to visit the exhibition outside this room, organized by the National Health Security Office and the Thailand Center of Excellence for Life Sciences, to showcase Thailand's innovations and health financing solutions that support long-term universal health coverage. Please be reminded that we will begin our first panel discussion back in this room in 10 minutes. Please enjoy. Distinguished guests, ladies and gentlemen, our first panel discussion will begin shortly. May I invite you to please take your seats. Thank you. เรียนแขกผู้มีเกียรติทุกท่านคะเรากำลังจะเริ่มช่วงอภิปรายแรกแล้วขอเรียนเชิญทุกท่านโปรดนั่งประจำที่ค่ะขอบคุณค่ะ Excellencies, distinguished guests, ladies and gentlemen, we hope that you have enjoyed the exhibitions. We will now proceed with the first panel discussion on global to national governance for sustainable UHC. I would like to invite our moderator, Ms. Nanut Mathurapot, head of the Global Collaboration Unit of the National Health Commission Office, to the stage. And may I also invite our distinguished panelists to kindly take their seats on the stage. Dr. Ailan Lee, WHO representative to Thailand, Mr. Toru Kajiwara, Minister and Chief of Economic Division of the Embassy of Japan, Dr. Sopon Iamsiri Thawan, Deputy Permanent Secretary of the Ministry of Public Health, and Mrs. Lalitaya Gongkham, Deputy Secretary General of the National Health Security Office. Ms. Nanut, the floor is yours.
Thank you, the MC, and I once again welcome to the panel discussion 1, Global to National Governance for Sustainable USC. Health systems around the world are navigating challenges from geopolitical tensions to economic pressures to climate change, AI era, and also on disruption in global supply chains. And at the same time, the global governance is reforming, including United Nations and the WHO. And this shapes the way the countries collaborate, finance, and sustain universal health coverage. This panel will bridge the global to national and also find ways collectively strengthen universal health coverage. And today we are honored to have 4 distinguished speakers, and each of them offering the distinguished perspectives on the future of UHC. So may I begin with Dr. Aylan. I would like you to give us an overview of reform in the WHO as well as UN Global Health Architecture. And apart from that, we would like to know what these changes means to the country level on the future of UHC. Thank you.
Thank you very much, Note. Nice to meet you again. Excellencies, distinguished guests, also my colleague here as a panelist. I still would like to start with Sawadika and also tell you that I'm very privileged, feel very privileged to be this discussion. And also I would like to thank to the Ministry of the Foreign Affairs and the National Health Security Office for your invitation. So to respond to your question, I think first of all, let me highlight three things. The first one, we are living in a very complex and turbulent world. We feel even more turbulent, as Excellency Minister just highlighted. This means the context for UHC is very different. And therefore, we believe that the reform is a must. Therefore, I really think Thailand's leadership has been amazing, and we would like to commend you. Now, back to the reform. WHO has been involved in 3 interconnected reforms that will have the impact on our own organization, but also broader global health ecosystem. The first one is our WHO internal reform. You all see the news. It has been very painful. WHO transformation is not new, but this is the extraordinary reform in terms of reprioritization to focus on the core function and also revisit our 3-level governance in terms of structuring and the resource mobilization. Second one is the UN 80 agenda. That reform is ongoing. There will be the implication to global health and the UHC. WHO has been involved together with my other UN agency who has a mandate in health, and too early to make final conclusion, but there will be the implication to the country level like UNCT. And the third one is be aware there are a lot of ongoing discussion on the global health architecture led by the different group. But all these reforms so far confirm that WHO remain important, of course, and we should focus on norm and standard. We should focus on those cross-border threats like health security threat. We should focus on our convenient role. So that's the 3. Should I mention a little bit about implication? Implication to the country level UHC sustainability. I think this is question I'm keen to learn from all of you. In my view, this global reform means opportunities, also challenges, but also uncertainty, because we still do not know how the world will be evolving. And this challenge, opportunity, and uncertainty will be the generic. But it depends on the many factors, depends on the direction of the global reform, depends on the country level political choice, depends on how we govern the UHC. To my view, is some countries already have a facing negative impact in terms of a global financial cut, ODA cut. And some African countries, we know that, like HIV and tuberculosis. But in some countries, did the opposite. They took this challenge as opportunity to step in the political decision and the government leadership for domestic financing. So that's the generic. So implication to Thailand, I am learning. I think Thailand has been very strong in the UHC, And we all know that. Therefore, you are not much dependent on international aid. So that's very good. I think you can have ability to manage this opportunity and the risk. However, as Excellency Minister mentioned, as the permanent, Deputy Permanent Secretary for Ministry of Public Health mentioned, you are facing aging, rising NCD, and many other unpredictable threats. Therefore, sustained UHC will be very difficult. But I think, in conclusion, I want to share my view is one, with all this global reform, what mean to the country level? First, national leadership and plus local innovative solution become even more important. I think that's the one, should not too rely on a lot of global. Second one, domestic financing, sustainable domestic financing. Because we're facing economic challenge, there's a tendency investment in health will be going down. But that's very dangerous. Investment in health is investment for economic development, for the social stability. I think we have to be very careful about that domestic financing and investment. And the next one is innovation, technology. We have to embrace AR, digital, while managing the risk. Because time is different, limited, I will not go further. But I see another one is a regional collaboration. We have a lot of regional group, regional entity. In the Asian Pacific, we have a lot of regional group. I think if we are working well and Thailand can play leadership, not only to improve the health of your own population, but also play even increasing role, leadership role to contribute global health and UHC, which you have been doing already. So thank you very much.
Thank you very much. Actually, not only looking at the global governance, but we have to look at ourselves and try to connect, align with each other. And the role of Thailand actually can contribute more than just our country.
Absolutely.
Thank you very much. Next, I would like to invite Mr. Kajiwara to share Japan's perspective on UHC. And actually, Japan has championed in sustaining UHC in a super age society. So I wonder, do you have any lessons to tell Thailand and other countries here? And apart from that, you also have Japan's Healthcare 2035. So can you touch a little bit on this one, including your Japan role in global health landscape?
Thank you very much. First of all, I think it's great honor and privilege for me to be invited to this meeting, and also congratulate, I think it's Thai Ministry of Foreign Affairs to host such event, because I think it's Thailand and Japan share many things, but I think one, I think it's a conviction that we share is, I think it's as illustrated by Foreign Minister Siasak just now, is I think it's global health is inseparable from foreign policy. And I myself as sort of brainchild of this, because I was been a diplomat, a Japanese diplomat for 27 years, but 2 years of my career I spent as a director on Global Health Corporation at the Ministry of Health, Labor and Welfare of Japan. So being very much involved, and I was very pleased to note that I think it's we held the second UHC forum in Japan, in Tokyo, just this weekend. And I was involved in the first one back in 2017. And just starting with, I think it's the similarities. I think it's between Japan and Thailand. I think it's not just beyond. I think it is global health diplomacy as a partner. Japan has achieved universal health coverage, as you know, for decades, starting with the 1961. But of course, as you know, I think highlighted now face one of the fastest aging population in the world. And this traditional structure, as you probably know, that the elderly center, the benefits, and largely financed largely by the working age population, is no longer tenable. The growing medical and long-term care needs, combined with the shrinking workforce, requires us to fundamentally redesign the system. So we recognize this, and under our new Prime Minister, Takaichi, our government has just announced the creation of national dialogue platform involving all stakeholders, not just government officials, but also all stakeholders, offer our people and citizens to reassess the balance of benefits and the contributions together with the public. So we're now entering the new phase of UHC redesign, maybe uncharted territory, that I think it's one that must address physical realities, workforce shortage, and changing societal expectations. And of course, fast changing demographic, I think, is the challenges. And healthcare, the 2035 vision, as you highlighted, was developed well before COVID. So it's long before, actually. But it still remains, I think, is very, very relevant as a reference. It calls for example, a patient-centered, value-based health system, because value for money is very important, and data-driven, technology-enabled smart health system, as highlighted by, I think, is their opening remarks, I think, is there just now. And a stronger shift towards prevention and community-based care, which I think is Thailand excels about it. And sustainable finance and system resilience, just as highlighted by, I think, is Dr. Adrian of WHO. So today's reform, we're now embarking, including our new national dialogue, very essential to the implementation of this phase of long-term vision, adapted to more urgent demographic and physical pressure. So then now I turn to this, my favorite topic, on Japan's role, and also Thai role, also global ODA and geopolitical shifts now we've experienced this. And we're facing with so many challenges, the geopolitical tension, climate risks, as we just experienced, pandemics, widening inequalities, and health has become central to human security, as just highlighted by Minister Sihasak. Japan has long supported, together with Thailand, as our co-chair of Group of Friends of UHC at the UN and other forums, the strengthening across Asian through ODA, working closely with WHO, of course, and World Bank, and many others, including the MDBs, and also the global funds and other funding mechanisms of the health systems. And our approach prioritizes long-term institution building, health financing reforms, and human resource development, areas that directly impact UHC sustainability across the world. So the UHC High-Level Forum, just held in Tokyo, just this weekend, on the 6th of December, co-led by Japan, WHO, and World Bank, is a very unique platform where health ministers and finance ministers participated together, just literally sitting next to each other. This joint engagement reflects Japan's long-term conviction that sustainable UHC requires very close cooperation between the health and finance authorities. Finally, I think it's, and most importantly, I think it's, Japan is very pleased that I think it's a new UHC knowledge hub just being created in Tokyo, and the emerging PMAC Global Health and the UHC hub in Bangkok can serve as complementary engines for strengthening UHC governance in Asia. So we're very, very much looking forward to this collaboration and also helping countries build together and stronger, more resilient, and more sustainable health system. Thank you so much.
Right. Thank you very much, Mr. Kashiwara. And as you mentioned many times about the dialogue, and dialogue is not among your society with different sectors, but also very important dialogue between health and finance to sustain UHC. And you even work with beyond the countries and make collaboration with many organizations to contribute to the global. But from Japan, I moved to Thailand because Thailand also facing many multiple challenges, as Dr. Sopon mentioned on your speech. So I would like to hear Thailand policy directions and on how to make health system resilient and sustainable amid the challenges.
Thank you very much, and good afternoon, Excellency, ladies and gentlemen. So Thailand is following Japan to be the super age society in right now, and also we think we have something that we have to prepare ourselves. First, if you look at the graph on your left-hand side, the number of population in Thailand is going down, but the healthcare expenditure is going up because we have more elderly people in the country right now. Looking at the map, most of the provinces in the northern part of Thailand and the central plain, we see increasing proportion of the elderly people. So this is the healthcare burdens that we have to cope with in the near future. And if we look at the community services, now we try to have integrated service for the primary healthcare. So we see people who live in the community, they have to help each other. As I mentioned earlier, we have over 1 million village health volunteers who serve as the key person in the community to take care of the people, not only healthy people but also elderly people or people with disability and chronic diseases. Right now we are promoting village health volunteer to be the health professional assistants so they can do more work. For example, visit the patient and then make sure that they are taking care themselves, like blood sugar and blood pressure monitoring, and also they also provide some of the support, for example, medicine from the hospital to the patient that they don't need extra medication. And this kind of services in the past were not well designed, but right now we have the payment system that help the village health volunteer to work effectively in the community, and we hope that this will slow down the healthcare spending for the aging population in the countries. And right now we are providing equipment to the village health volunteer. For example, the digital tool like the application we call Mopom Super App. So the village health volunteer can use this kind of application to input the data of the patients and the villagers in the catchment area, and then contact with the primary care providers at the health promotion hospital, formerly health center, and also the district hospital. So by this way, the health information will be shared with the doctor at the different healthcare settings. So this is one of the innovation that we try to make it available in our villages. This is some of the example of the digital health innovations. The health promotion hospital located at the sub-district level, around 9,000 hospital in all sub-district will be equipped with the telemedicine, so the patient and the doctor can directly communicate through this kind of system. Mobile health application I already mentioned, but we try to upgrade it to be something that useful for health promotion, and also for example, vaccination. Right now we ask the parent to follow up the schedule of the vaccine of their children, so it will be available in the mobile application very soon. And we have a financial data hub that we can link the healthcare reimbursement data to the care service provided by the hospital. So this kind of innovation will help improve the efficiency and lower the cost of the healthcare expenditures. Some of the policy implemented recently, we would like to have extra resources using the domestic resource. For example, in our Thai healthcare system, we divide the 76 plus Bangkok, 76 provinces plus Bangkok into 12 health regions, and we have the policy called one region, one province, one hospital that try to manage the resources within one region, which has allowed 4 to 8 provinces, and the number of hospital allow 50 to 70 hospital. So by having the effective management plan, we can utilize the resource more efficiently, and the hospital in the financial crisis will get extra funding from the government and also from the health regions by working closely with the NHSO to improve payment. In some major hospitals, we also provide premium clinic on the weekend and also after the office hours. So those who are willing to pay, for example, those who have the private health insurance can also utilize the service in the premium clinic for the extra income of the hospital. And last but not least, the cost monitoring and evaluation of the measures and interventions that hopefully will make the resource used more effective in the hospitals. And this is something that we already seen in before. The safe framework that Thailand want to share with the global communities. For example, sustainability that we discussed quite a lot today. As the Thai healthcare system rely mainly on the domestic fund, we hope we can manage this. The adequacy is a main issue right now. Ministry of Public Health and the National Health Security Office are working closely to make the financial support adequate for the hospital and the fairness. This is also the issue that we want to make all the insurance schemes in the country provide equitable healthcare to people, and of course efficiency, as I mentioned earlier. Okay, so as we show that USA is not only a policy but it's a long-term commitment, so we have to ensure that no one is left behind. So many new investments have been placed for the primary health care, and we want to empower the community health workers as village health volunteer is a main target, but we also want to move on to the villager and also the leaders in the communities. And the digital transformation is our hope to make the new paradigm shift to the better and also more effective healthcare in the country, and strengthening the governance that we discussed quite a lot during this time. So everything Thailand is doing now try to align with the global health reforms and with the sustainability, that this is the final goal. Thank you very much.
Thank you, Dr. Sopon. Listen, your presentation make me feel confident in health system of Thailand. And thank you that you mentioned about SAFE, SAFE framework. So I would like to ask Dr. Lalitaya, how you and UHC work under this framework? Thank you.
Yes, thank you. Excellency and distinguished guests, to respond to the question about Thailand UHC. Now we in the 24th year, younger than Japan in the 6th decade. And today, our service coverage index had reached 82%, comparable to many income countries. Catastrophic health spending and health-related impoverishment have dropped significantly since UHC was introduced. The result comes from whole government and the whole society approach. And we face challenges as well. We face aging society, more complex disease, and rising health costs, and high public expectation both from patient people and from the hospital and service providers. We spend about 16% of its government expenditure on health, but add more money is not enough. So we introduce safe health financing framework is from sustainability, ensuring the long-term financing for the country government and households without drawing on future generations. Thai UHC has continued across 11 prime ministers, 16 health ministers, showing strong political commitment is the strong important factor for sustainability. And Thai UHC has relied on 100% of domestic resource since day one, even when Thailand was a lower middle income country. For adequacy, we have to ensure that we have resources must be sufficient for people to access essential care without financial hardship. But our challenging today with the budget enough for the hospital and enough for the service provider to it's a critical enable UHC. Yes. And for the fairness, in Thailand we share between rich and poor. We share between urban and rural. So it is and our clear data show that rich groups contribute more to progressive tax, while the poorer groups receive a slightly more benefit from public health service. Remaining challenges include inequity across schemes and access barrier for migrants and non-Thai. For efficiency, I would like to address more about the efficiency, because the resources must be used wisely to get the most health for everyone, for every baht. For UC scheme, many strategic purchasing applied. Pool procurement, for example, renal replacement therapy solution, we can save over 51 million US dollars per year. Evidence-based health benefits using the health technology assessment and cost effectiveness. Cross-end budget and mixed payment system to control cost with quality. Ongoing effort to reduce low-value care, such as unnecessary imaging, non-indicated cesarean section. The question is not only do we have enough, but are we using well? So this brings us to efficiency. Higher cost does not always mean the better quality. Thailand, 40% of cesarean section rate, one of the highest in the Southeast Asia, illustrate overuse of service despite high risk. Other inefficiency include unnecessary procedures, overdiagnostic, and inappropriate inpatient care. As Dr. Suwit Wibunpun said, one of our board members said, money is important, but barely used money can create problems. To improve efficiency, Thailand uses a cross-end budget. We use health technology assessment to introduce new health benefits package. We use abundant payments. We have a pool procurement, and we have a strong monitoring and evaluation and audit system. This means health ensure every baht deliver maximum use, maximum value. and strengthen the long-term sustainability of UHC in Thailand.
Thank you very much. Actually, SAFE framework is not only good for Thai universal health coverage, it's good for any development projects that everyone can apply. But actually, we quite run out of time because this session is quite limited. But I cannot stop this panel without asking the last question. So what is the one change that we must make it in the next 10 years to protect USC for the future challenges? I don't want to say like whoever want to start first, please do. Who would like?
May I go
So,
first?
so let me swap like. Can start from Dr. Lalitaya, if you don't mind, from backward.
Yes. I think the most important change for the next 10 years is shifting our mindset about to seeing UHC not for a cost, but for the investment for the people, to keep the people healthy, to keep the people have a product for the country economics aspect. So we have to invest in UHC. We improve health and strengthening the economy at the same time. For example, already underway include in Thailand, we are hiring community caregiver, which create a local job and have the bridge between the health system to the people in the community. So this is one form, many return. Innovations like in Thailand, we just
Only one change. Otherwise, the rest cannot answer the question. So one is the mindset. Would you like Dr. Sopon, please?
Yeah, that's really good questions. I may have different ideas. I think USA in Thailand is like 100% free of charge. And nothing can survive for 100% free. So we should think carefully about the co-payment at the reasonable rate. For example, many diseases like NCD come from behavior, right? They take their own risk factors, and when they develop the disease, they should also share responsibility to take care of themselves. So we should have a critical consideration. What would be the best way to sustain the USC when we have many disease and in the aging population? Co-payment may be something that we can discuss later after this session. That's something that we can make a change, significant change.
Shortly, I would say change mindset, maybe change the model. It could be that. Mr. Kajiwara?
I think it's you taken to think two out of me, but I think it's the technology, I would say. I think it's in 10 years, I think it's we would be having more precision medicines, for example. They're very targeting, I think, diseases I think it's you really need to cure. And not harming kind of your good part of the body. And also I think it's your more evidence-based sort of solutions. I think it's be it medical care or long-term care. So I think it's technology allow us to have more focused and cost-efficient intervention that will be, I think, beneficial. That's something that I think we have to change the mindset. And also, I think it's also we have to design good co-payment system that are sort of tailored for sort of ability to pay by each individual. Thank you.
Thank you. Mr. Kachiwara mentioned about technology, right? And now, Dr. Ailan.
It's challenge, right? Because you read my mind. So I will choose the keywords prevention. Focus on prevention and promotion. Advancing prevention and promotion focus on primary health care because these are most cost-effective and sustainable intervention. We know this but we have not really invested this in the many countries. Thailand has been championing. So secondly, I think when talk about health, health is determined by many things, right? We cannot change our generic profile, but health determined by our own healthy behavior, as Dr. Sopon mentioned that. Individual have responsibility. Health determined by the environment you are living, air, water, food, road, and health determined by other determinants like poverty, education. So I think we need to do a little bit focus on not only seek care, but make healthy population even healthier. And maybe just one more second. As Dr. Tedros mentioned, again, health is created at home, community, and the society where we are living. So I hope this really paradigm shift can be the decision by political and other partners.
Sure. Thank you. I think we have to combine all these changes, mindset, and perhaps new model, technology, and think not just like in the health area, but more on healthy societies. And plus, USC is not just healthcare or health financing, but more on health prevention and promotion. So thank you very much for your presentation and insightful perspectives. And also to everyone here, thank you for your engagement and commitment to USC. Once again, thank you for this chance that I have moderate the great speakers here. Thank you.
Thank you to our distinguished panelists and moderator for the insightful and enriching discussion, which explored emerging reforms and how global, regional, and national mechanisms can be better aligned to support strong, equitable, and sustainable UHC systems. As we prepare for the next session, I'd like to give a brief overview of our second panel discussion, which will focus on how Thailand can sustain UHC in the face of major shifts, such as an aging population, rising health expenditures, costly modern technologies, and constrained budgets. We will now proceed to our second panel discussion on shared responsibility, multi-stakeholder approaches to sustaining UHC. I would like to invite our moderator, Dr. Thanasak Thambantu, Director of the Bangkok Regional Office of the National Health Security Office, to the stage. And may I also invite our distinguished panelists to kindly take their seats on the stage. Dr. Karen Bredenkamp, Practice Manager for Health, Nutrition, and Population in the East Asia and Pacific region of the World Bank. Dr. Jare Wishathai, Research Manager at the Health Systems Research Institute. Professor Apichat Asawa Mongkol-Gun, Dean of the Faculty of Medicine, Sirirat Hospital, Mahidol University. Mr. Apiwat Gwangkeo, representative of the Network of People Living with HIV and AIDS and Chronic Diseases. And Dr. Surapot Suwanpanit, private hospital representative on the Quality and Standards Control Board. Dr. Thanasak, the floor is yours.
Excellencies, distinguished delegates, ladies and gentlemen, it's my great honor to welcome you to the panel discussion 2 of the International USC Day. So this afternoon, the panel 1 reminded us that no country can achieve secure health, equity, and financial sustainability alone. These are shared responsibility across borders, sectors, and communities. I think that I was inspired by Dr. Island mentions that actually health is not belong to only health sector, but we can achieve health by the actions of social or maybe like politics as well. So it is a shared responsibility among all of us. So before we begin, I would like to draw your attention to the illustrations behind me here. Please share the slide, please. So a picture we call the UHC safety net. At the top, powerful forces like geopolitical shock, climate change, and pollution or global economic pressure put the people into a river of illness. One strong fence of international cooperation is weakening, leaving more people vulnerable. Downstream lie our UHC safety net, catching those who fall. Yet the net itself is being strained by aging, rising costs, fiscal pressure. Still, it's held together by many hands. We can see the government, academia, civil society, private sectors, and international partners, each reinforcing a vital role. So panel discussion 2 will focus precisely on this part of the system, strengthening the safety net while we mitigate the forces upstream. As Thailand enters its 24th year of UHC, we face multiple transitions at once, such as aging population, shifting disease burden, and tightening fiscal space. These pressures challenge every component of health system. However, it also provides us an opportunity to rethink how we can collaborate better to sustain universal health coverage. So to conduct this session, each speaker will now offer brief insight in response to the guiding questions provided. Let's begin. We will start with the global perspective, then move through national and community lenses to build a complete picture of shared responsibility. So I would like to ask Dr. Karine first from World Bank. I, as someone working closely in health financing, especially in Bangkok, I often see health budgets framed simply as an expenditure, a cost to be contained, rather than an investment to be leveraged. This framing makes it difficult to secure resources for long-term health and productivity. Dr. Karine, from the World Bank's perspective, how should we shift this narrative so that health financing is understood not as consumption, but as investment that drives economic growth and resilience? And how do you see Thailand's performance on UHC?
Thank you so very much, Dr. Thanasak. And ladies and gentlemen, I'm delighted to have been invited to join you here today in Thailand's celebration of Universal Health Coverage Day, and also to share the stage and indeed this entire hall with so many people who have dedicated their careers to transforming Thailand's aspiration for universal health coverage into a reality. It truly is a privilege. I think as many of you know, the World Bank is a financing partner and also a knowledge partner, working with many low and middle income countries across the world. And in so doing, I would like to share with you that Thailand is a country that we often hold up as an example of how to attain universal health coverage in a fiscally sustainable way. I know that you're grappling with many changes that are so beautifully illustrated in the cartoon that you showed, Dr. Thanasak. But I think it's important also to remember that Thailand is an inspiration for many countries. And because of this, the World Bank has brought many delegations from various countries across the world to visit Thailand to learn about your UHC implementation experience, and also taken Thai experts to other parts of the world to provide hands-on support and technical assistance. So what I would like to do, in fact, is to tell you a little bit about the reasons why we consider Thailand to be such a prominent example of attainment of UHC in a fiscally sustainable way. I think, first of all, the results speak for themselves. We heard reference earlier to the Global Monitoring Report and the new one that was released. Thailand attains a score of 82 on the UHC Service Coverage Index. This is an outcome comparable to that of France and that of Ireland, who score exactly the same amount. But yet Thailand achieves this at a fraction of the cost. So France spends about 12% of GDP on health. Thailand, as you know, spends under 6%, right? Ireland spends, it's a big number, $6,400 per capita on health. Thailand spends only $370 per capita on health. And also, Thailand's out-of-pocket spending provides financial protection. This is contained at 9.2% of total health spending. So this means that Thailand is achieving UHC at low cost to the people and also to the public purse. You know, and when we see this great achievement of Thailand, right, the next question that always comes is how did Thailand do this? What is the secret of their success? And I know I don't have a lot of time, but I would like to outline for you the three things that we always say are fundamental to the success. The first is the very strong focus that Thailand has put on prevention. The Thai system helps to prevent people from getting sick in the first place through encouraging healthy behaviors, lifestyle changes, and encouraging people to make smart and healthy choices. And I think that Thai Health, the Thai Health Promotion Foundation, has been absolutely pivotal in this. For example, you can think about the measures to increase tobacco tax and other tobacco control measures, encourage healthy exercise, and improve diets through sharing nutritional information. The second thing that we say is that Thailand has ensured wide availability of free primary health care. This means that people are not forced to forego needed care or even delay needed care. People have access to a primary health care facility in very close proximity to where they live. And moreover, this care is provided free without the need for a copay. And this is enabled by the three public financing schemes that Thailand has, right? Of course, the CSMBS, Social Security, and for those who are not covered by neither of those, the UC scheme of NHSO. And I think this really helps in the early detection and management of diseases before they worsen and become more difficult and more costly to treat. And finally, I would like to recognize how Thailand effectively controls the cost of inpatient care through a well-designed provider payment system. Thailand is recognized as a regional trailblazer in the implementation of the DRG financing mechanism. But more than that, Thailand had the great foresight to, from the very beginning, implement the DRG system together with a global budget, which means that Thailand is able to contain cost growth and thus limit the annual increase in the spending of inpatient care, and I think you limit it to around 6% annually per year. So this is in fact sustainability by design. This is complemented by many other mechanisms, such as the health technology assessment that brings into consideration always questions of cost effectiveness and of total cost and of potential savings. It's also complemented by a very strong medical claims audit system that on the one hand helps to spot fraud and prevent gaming of the system by providers, but also uses that claims data to monitor and improve the quality of care. And so for this reason, the bank has also partnered with Thai institutes such as NHSO and the Thai Case Mix Center to share your good practice in DRGs with global budget with other countries. If you'll permit me just another 15 seconds, I would also like to share with you, ladies and gentlemen, that next year, Thailand will be hosting the World Bank's annual meetings. So this is a very important meeting which brings together the highest level representatives of each of the World Bank's member countries. And so it's really special that this will be hosted in Thailand. And in the run-up to these annual meetings, the World Bank will be working with Thai authorities on what we call a road to Bangkok to showcase Thailand's achievements, Thailand's development achievements, and also work together on a flagship report to articulate a vision for the future of the economy. And in my view, I have no doubt that an essential part of this story is and will continue to be Thailand's investment in human capital and in health through UHC. Thank you.
Thank you very much, Dr. Killeen, for this powerful speech. I feel like as Thai, I feel happy when you told that this is a successful story of Thailand and it's encouraged us to move forward for the USC. And you also highlight about the secret sauce of the success of universal health coverage in Thailand, which is prevention, invest in prevention, investment in timely, free primary health care, and also for the strategic purchasing, we use the payment mechanism that create efficiency in terms of like health financing, right? So she highlight like all these secret sauce of the success of universal health coverage in Thailand. And thank you very much for your insightful information. Okay. Okay. So then, from the global perspective, we will continue with the national level. So we will look at the perspective from Dr. Tere from the Health System Research Institute. Dr. Tere, how would you evaluate Thailand's USC experience, and how might we adjust our course to reinforce sustainability over the next decade? The floor is yours, Kap.
Thank you very much. A very hard question. Before I starting, it's a pleasure to be invited to be a panelist on this session. And distinguished guests, ladies and gentlemen, I think this would be our perspective from HSI Health System Research Institute. I can make it short because some of my ideas or perspective are similar to the previous panelists. I think what we trying to do is to give the pathway of the three public health insurance schemes in Thailand. I think the pathway we have to walk together. The thing is, I think we actually need a UHC new version. The previous version or the existing version, we are focused on the coverage. I think we have done very great. Our performance very good. The quality, the access. The UHC, the second version. I'm thinking about how we're going to have, like the previous panelist said, about how we're going to capitalize the use of the precision medicine, the technologies, or things about innovation that could lead us to have the greater value of healthcare system. How are we going to do and work together as the common ecology? These things I'm going to detail in the three shifting mindsets. Hang on. One, we have already talked about the prevention promotion. We have to shift from the sick care to the prevention promotion and invest more on the technology, the clinical precision, the precision medicine, also the public health technologies. Because right now, I think all this technology, it cannot be unimaginably. Things like that, we have to invest more, and we have to, I think our system has to be more customized, more effective. The second one, we have to think about the value, thanks to Dr. Lilita, because NHSO, I think we all have in common about how we're going to invest in our healthcare system to give more value, right? The value function is health outcome divided by the cost of delivering outcomes, right? How we can slightly change a bit or tweak the payment system to have more payment, the outcome-based payment system, right? It cannot be a radical change, but we have to slightly change and give the provider to get them more familiarized with this system. Technology assessment. HSI, right now we fund a lot of research proposal about health technology assessment because we agree with the NHSO that our public health insurance benefits has to be more cost effective, right? However, if we think about the rare disease, because rare disease coming with the costly technology, costly medicines, how are we going to support this treatment? I think one of the things we have to talk with for example, the pharmacy companies, the technology companies, is it possible that we can pay you the full cost right? If the technology or the medicine cure fully, however, if it doesn't cure, can you refund a bit? Things like that could be an approach to have a shared responsibility in our ecology system. Last, I think we know that our care system is so fragmented. How are we going to work together? Right now, we know that NHSO has a mechanism working with the other two public schemes in order to harmonize the benefit schemes, harmonize the payment systems. I think we need more than that. We're thinking about how we're going to harmonize the health settings. Of course, we have to include the non-government organization setting as well to work together. One of the things I think is a tool, a very powerful tool is the data system. How we can get the data going faster than the patient coming to the health system. Things like that, it's possible right now. And the last is the conclusion. I think what we need, the three chief things, we also need leadership. We need a system conductor. Who is going to be the system conductor? The leadership is very important to lead us to the new version of UHC. Thank you very much.
Thank you very much, Dr. Shrey. You reminded us that Thailand must move from fragmented, quantity-driven care toward a connected, value-oriented ecosystem. You also highlighted the need to broaden traditional HTA toward more humanized and flexible approaches, especially for rare diseases. And you left us with an important question on innovative financing, suggesting that new approaches may be needed beyond conventional methods. Thank you again for this thought-provoking contribution. And as we all know, that sustainability of USC rests heavily on health workforce. So I would now turn to Professor Apichat from Sirat Medical School. Professor Apichat, from the perspective of medical education and service delivery, what transformations are needed to prepare providers for future complexity and quality demand? And what roles should medical school play in strengthening universal health coverage?
Thank you, Dr. Thanasak. Good afternoon, His Excellency, distinguished guests, and esteemed colleagues. It's my great honor to share the critical perspective and also the fundamental pillar of the health system, the health workforce, and also its roles for the sustainability of the universal health coverage. As the dean of the biggest hospital of the country and the representative of the university hospital networking, and we have around 22,000 outpatient daily and also about 2,600 inpatient beds per day. So every day we force about the work of my healthcare workforce because we have more than 20 or 30 nursing resigning to change their position to work in another place, maybe change their job. So again, to set the context, we must recognize the mega trend of the global health challenges. The first one is the demographic transition and aging society. This is very important because less professionals come to the position, and also we need the more expertise to take care about the elderly patients right now. For the climate change and environmental health, as we know, is posing the new health impact threat every day. Geopolitics and global health governance. This is effect to many resources, the flows, and so also cooperation. And last but not least, about the digital disruption, digital health, and AI. This is very important, especially for the aging society, and we need to have our workforce to have the new skill requirement. And as you see these pictures, this is the global health workforce. You can see it's uneven distribution. The red one is the hard shortage, and also the blue one is the plenty of the health workforce. The uneven distribution is mean the healthcare that we can give for the equality is going to be questionable. And also we need the universal health coverage. Even Thailand is still only above the average of the health workforce right now. This is the data from the WHO in 2020. For the WHO reported on the health statistic and health workforce in Thailand, 54% of the population is living in urban. And as we see from the graph about the density of the medical doctors, nursing, pharmacists, the dentists, we seems to be getting better. Right now it's about 46.6 when compared with the 10 years ago, it's about 24.5. We are getting more than the average of the WHO is of 22.8 per 10,000 population. And luckily that the data from Thailand for the universal health coverage, for the service coverage index, we are in pretty higher than the average of the regional. And also the community health workers is getting more numbers in this year. And we feel that these health workers, instead through effective functional of primary health care and district health system, are often the first point of contact of those most vulnerable and for emergency response. Yes, as Thailand have the more production, but our healthcare workforce still in the crisis situation. So I would like to use the PESTEL, the framework, to analyze. Number one is maldistribution, uneven resource allocation, low morale, inadequate compensation, and low benefits. Aging workforce, we have the approaching retirement age, skill gaps, we lack of the emerging health challenges, and the rural shortage, the distribution remote areas very challenging, and the migration seeking the better opportunities, like I told you in the first the discussion that I lost my nurses and pharmacists daily, more than 20 or 30 positions. And also because of the shortage of the healthcare personnel, it's direct impact to the healthcare system. Reduce the access because the limited time, less workforce, more patients, this will reduce the quality of services. Increase the waiting time, especially for the long waits of the appointments. Compromise quality because of stress and burnout can, induce a lot of errors. Increase cost because we use a lot of money, try to attracting and retain our professionals. And for the distribution and the gap between the urban and rural socio-economic gap. That's another issue that we need to. So I would like to propose that if we need to have just some solution, we need to think about the strategic to maintain and solve the workforce crisis. So number one is national health workforce planning by developing comprehensive plans aligned with the national priorities. Strengthen interprofessional education by investing in quality education and training programs. Improving working conditions by creating supportive and rewarding work environments. Task shifting and task sharing by training community health workers to perform traditional tasks. And lastly is leveraging technology by utilizing technology to improve access and support them. So even we have the health workforce crisis in Thailand, but we do strong for the personnel who have very strong dedication to help our patients. And also we have the very good quality in level of our personnel and also the expertise in our countries. So again, we should have some synergy strategy, especially for the interprofessional workforce. how can we motivate and engage our professionals. So the three things that I will propose. Number one is synergy in the professional education program. Is number one. Number two is retention and empowering professional, especially in primary health care. Lastly is the efficient technology-enabled delivery. So I think this is the collaborative and modern care to give the new innovation about the collaboration. I think this should be another one solution that we can use. So in conclusion, I believe that global workforce shortage, not in Thailand, but global, is very significant challenges. Thailand has the strengths, particularly its dedicated personnel and increasing capacity. The strategic areas in the education, retention and technology to ensure a robust health workforce for sustainable universal health coverage. It should be the thing that we should think in the future. Thank you very much.
Thank you very much indeed, Professor Apichat, for outlining the workforce trend, the challenge ahead, and a strategic direction that we should heading toward. As healthcare is profoundly labor-intensive weakness in workforce management, veteran maldistribution, low compensation, or competency challenge or migration directly undermine the UHC goal, affecting access, quality, equity, and system efficiency. So you clearly showed the strengthening national coordinations, promoting interprofessional education, enabling task sharing, and maximizing technology will be essential to sustaining universal health coverage. Thank you once again. We often discuss UHC from policy, financing, or delivery perspective. But the true nature of UHC lies in whether people feel protected, included, and fairly treated. Kun Apiwat, since you will speak in Thai and we will follow your message on the screen, may I invite you to address this question. From the people's point of view, what makes USC fair, responsive, and trustworthy, and what must we protect to sustain these gains?
ครับก็สวัสดีทุกท่านนะครับที่เปิดโอกาสนะครับให้กับภาคประชาสังคมได้เข้ามาร่วมเวทีในวันนี้ในมุมมองของประชาชนถ้าพูดถึงเรื่องระบบหลักประกันสุขภาพแห่งชาติที่ยั่งยืนในตัวเองก็รู้สึกนึกถึงอาจารย์สงวนนิตยาลำพงษ์ซึ่งเป็นบิดาแห่งระบบหลักประกันสุขภาพแห่งชาติซึ่งวันนี้เราเดินทางมา24 ปีแม้มีอุปสรรคมากมายหรือมีจุดแข็งจุดอ่อนเราก็ฝ่าฟันกันมาได้เวลาเรามองเรื่องระบบหลักประกันสุขภาพแห่งชาติไปทั้งระบบเรามองเห็นบุคลากรที่จัดบริการที่อยู่ในระบบนั้นในทั้งรัฐและเอกชนว่าท่านเหล่านั้นจะมีคุณภาพชีวิตที่ดีได้ยังไงจะจัดบริการได้อย่างมีความสุขทำงานในระบบอย่างมีความสุขได้ยังไงและในขณะเดียวกันประชาชนที่อยู่ในระบบมันคือชีวิตคนทั้งชีวิตที่อยู่ในระบบนั้นไม่ว่าเขาจะป่วยก็ดีจะเป็นผู้สูงอายุก็ดีหรือแม้แต่เขาจะเป็นคนที่ยังไม่ป่วยก็ดีเนี่ยผมคิดว่าสิ่งเหล่านี้มันมีชีวิตมันมีเรื่องราวมากมายที่เราทุกคนณที่แห่งนี้รวมทั้งฝ่ายวิชาการฝ่ายเอกชนภาคนโยบายผมคิดว่าถ้าเรามองให้เห็นชีวิตคนทั้งชีวิตเนี่ยเราก็จะเห็นความหลากหลายในระบบของเราเพราะฉะนั้นถ้าระบบของเราจะยั่งยืนเนี่ยผมคิดว่าในมุมมองของประชาชนเนี่ยผมมีอยู่สัก 2-3 เรื่องสั้นๆนะครับอันดับแรกเรื่องสุขภาพเป็นสวัสดิการพื้นฐานครับให้กับประชาชนทุกคนบนพื้นแผ่นดินไทยครับเราต้องยึดหลักการนิดนึงนะครับว่าประชาชนจะต้องไม่เสียค่าใช้จ่ายครับเพราะประชาชนได้จ่ายก่อนป่วยไปแล้วครับผ่านระบบภาษีและประชาชนจะต้องเข้าถึงครับที่สำคัญก็คือว่าต้องได้มาตรฐานครับแล้วก็ต้องมีส่วนร่วมครับของทุกภาคส่วนเพราะฉะนั้นจุดยืนของระบบ UC ที่มันยั่งยืนมาจนถึงวันนี้มันคือระบบของการมีส่วนร่วมของทุกภาคส่วนที่รู้สึกว่าเข้ามาช่วยกันจัดบริการครับเป้าหมายที่สำคัญอีกอันหนึ่งก็คือการมุ่งสู่เป้าหมายเดียวกันครับบางทีเราทำงานด้วยกันเราอาจจะมองเป้าหมายที่มีความแตกต่างกันแต่ถ้าเรามีเป้าหมายว่าเราจะลดความเหลื่อมล้ำสร้างความเป็นธรรมในระบบสุขภาพทำให้ทุกคนมีมาตรฐานเดียวกันถ้าเรามีเป้าหมายเดียวกันแล้วเนี่ยผมคิดว่าไอ้นี้ทั้งประชาชนและคนจัดบริการหรือแม้แต่สำนักงานหลักประกันสุขภาพแห่งชาติหรือทุกภาคส่วนถ้าเราเห็นเป้านี้แล้วเราจะไปสู่เป้านี้ด้วยกันยังไงก็ช่วยกันออกแบบครับอีกอันหนึ่งสิ่งที่เราต้องนึกถึงมันก็คือเรื่องการทบทวนกฎหมายและนโยบายที่เป็นอุปสรรคต่อการเข้าถึงของในระบบหลักประกันครับสุขภาพของประชาชนรวมถึงการมีส่วนร่วมทุกภาคส่วนครับ อีกอันหนึ่งเราควรจะสนับสนุนส่งเสริมในการหนุนเสริมกันครับหนุนเสริมทั้งระบบครับนโยบายต้องส่งเสริมนโยบายต้องหนุนเสริมคนทำงานต้องส่งเสริมกันครับมันจะทำให้ระบบมีความยั่งยืนมากยิ่งขึ้นอันถัดไปผมคิดว่าสำคัญมากๆก็คือส่งเสริมการมีส่วนร่วมของภาคประชาชนในระบบหลักประกันครับไม่ว่าจะด้านโดยเกณฑ์การป้องกันก็ดีหรือด้านการรักษาก็ดีหรืองานคุ้มครองสิทธิ์ก็ดีเพราะนั้นผมคิดว่าทุกกลไกต้องเข้ามามีส่วนร่วมที่สำคัญความยั่งยืนด้านนโยบายผมคิดว่ามี4เรื่องใหญ่ๆที่ผมคิดว่ามีความสำคัญครับส่วนอีกอันหนึ่งผมคิดว่าความยั่งยืนทางมาตรการทางการเงินครับทางมาตรการทางการเงินผมคิดว่าการบริหารจัดการงบประมาณเราต้องใช้หลักการที่สำคัญเหมือนกันนะครับเพราะว่าเราใช้เงินเม็ดเงินภาษีนะครับการหลักการสำคัญของระบบหลักประกันสุขภาพแห่งชาติเราต้องยืนอยู่บนหลักการของการเฉลี่ยทุกข์เฉลี่ยสุขครับเพราะนั้นการมีระบบเฉลี่ยทุกข์เฉลี่ยสุขก็ยังไม่พอนะครับเราต้องนึกถึงเรื่องการมาตรการการควบคุมค่าใช้จ่ายอย่างมีประสิทธิภาพครับการค่าใช้จ่ายที่มีประสิทธิภาพนั้นมันก็จะนำไปสู่ความยั่งยืนครับเพราะฉะนั้นถ้าเรายังบริหารจัดการงบประมาณอย่างไม่มีประสิทธิภาพแล้วเราก็ยังใช้ลักษณะของการบริหารแบบปลายเปิดผมคิดว่าไอ้นี้อันตรายแต่ถ้าความยั่งยืนผมคิดว่าเราต้องบริหารงบประมาณแบบปลายปิดและช่วยกันมาบริหารและช่วยกันมองว่าอะไรที่มันสำคัญแล้วเราจะมีกลไกยังไงในการที่จะจัดการราคาค่ารักษาให้มันเป็นธรรมกับทุกฝ่ายครับอันถัดไปผมคิดว่าการจัดสรรงบประมาณอาจารย์หลายท่านได้พูดถึงแล้วพูดถึงเรื่องเพียงพอแล้วก็เหมาะสมต่อสถานการณ์ครับบางทีมันมีหลายเรื่องในนี้ที่มันมาเพราะฉะนั้นผมคิดว่ามันมีรายละเอียดเยอะเพราะฉะนั้นเราต้องเอารายละเอียดทั้งหมดนั้นมาสู่การสื่อสารที่เข้าใจตรงกันครับจะได้ไม่เกิดข้อผิดพลาดหรือว่าการสื่อสารที่อาจจะเข้าใจไม่ตรงกันแล้วก็อาจจะมีปัญหาในการสื่อสารได้แล้วก็ทำให้ประชาชนนั้นสับสนได้เช่นเดียวกันอันถัดไปครับการมีกลไกนะครับผมคิดว่าการรวมกลไกทุกภาคส่วนเลยครับในการบริหารจัดการงบประมาณครับแล้วรวมถึงเรื่องการตรวจสอบนะครับในการที่จะดูที่งบประมาณมันมีประสิทธิภาพไหมบริหารงบมีประสิทธิภาพไหมประชาชนจะมีส่วนร่วมได้ยังไงทุกภาคส่วนจะมีส่วนร่วมได้ยังไงเพราะนั้นผมคิดว่าการทำงานร่วมกันแบบกระบวนการเป็นเครือข่ายและหนุนเสริมกันมีความสำคัญมากโดยเฉพาะเรื่องงบประมาณนะครับอีกอันนึงผมคิดว่าการบริหารจัดการเนี่ยเราก็จะต้องช่วยกันดูนะครับบางครั้งเราบริหารจัดการงบประมาณบางครั้งมันก็อาจจะตอบสนองฝากฝั่งการเมืองมากเกินไปอาจจะต้องพิจารณาดีๆครับว่างานนโยบายแบบไหนการบริหารเงินแบบไหนเนี่ยที่มันจะสมเหตุสมผลและมันทุกฝ่ายพอไปได้ประชาชนก็ไปได้ระบบไปได้คุณหมอพยาบาลกระทรวงสาธารณสุขทุกฝ่ายไปได้ผมคิดว่าอันเนี้ยก็ช่วยกันดูครับในระบบการเงินจะช่วยกันบริหารจัดการยังไงก็ผมคิดว่าเรื่องนี้เป็นมาตรการในมุมมองของประชาชนที่มีความสำคัญมากๆนะครับส่วนอันที่อยากจะพูดถึงอีกอันหนึ่งซึ่งคือการมีส่วนร่วมผมคิดว่าโจทย์หลักของเรื่องการมีส่วนร่วมเนี่ยผมคิดว่าการมีส่วนร่วมที่ความยั่งยืนของระบบเนี่ยมันคือการมีส่วนร่วมของภาคประชาชนและทุกฝ่ายที่ทำงานด้วยกันโจทย์แรกผมคิดว่าเรื่องแนวคิดทัศนคติเรื่องระบบสุขภาพครับมันต้องเป็นของทุกคนครับเป็นของบุคลากรทางการแพทย์เป็นของประชาชนทุกคนครับเป็นของคนไข้ที่อยู่ในระบบผมคิดว่าแนวคิดนี้เราควรจะต้องตอกย้ำและทำความเข้าใจกันอย่างต่อเนื่องครับว่าระบบสุขภาพเป็นเรื่องของทุกคนจริงๆนะครับไม่ว่าเขาจะป่วยหรือเขาไม่ป่วยเพราะฉะนั้นทุกคนต้องรู้สึกว่ามันเป็นเรื่องสำคัญครับอันถัดไปผมคิดว่าการสนับสนุนประชาชนมีส่วนร่วมในการดูแลสุขภาพตัวเองครับเรื่อง health literacy ครับมีความสำคัญกับประชาชนทุกคนว่าเขาจะเป็น health literacy ได้ยังไงเพียงแต่จะทำงานแบบไหนเพียงงานแก้ไขเพื่องานรักษาอย่างเดียวระบบไปไม่รอดครับอาจารย์หลายท่านพูดถึงเรื่องการป้องกันส่งเสริมป้องกันโรควันนี้โจทย์ที่ท้าทายของประเทศเรารวมทั้งภาคประชาสังคมอย่างพวกเราคือการทำงานส่งเสริมป้องกันโรคครับงานส่งเสริมป้องกันโรคที่ดีที่สุดไม่ได้อยู่ในมือหมอครับไม่ได้อยู่ในมือบุคลากรทางการแพทย์ครับมันต้องอยู่ในมือของประชาชนครับมันถึงจะเกิดการเปลี่ยนแปลงในการส่งเสริมป้องกันโรคครับอันถัดไปผมคิดว่าการส่งเสริมสนับสนุนภาคประชาสังคมให้เข้ามาจัดบริการในระบบหลักประกันสุขภาพแห่งชาติครับซึ่งตอนนี้หลายคนอาจจะมองว่ารับงบประมาณจากต่างประเทศหลายประเทศตัดงบลงแต่ประเทศไทยเราก็นึกถึงเรื่องความยั่งยืนครับเพราะฉะนั้น จัดบริการโดยประชาชนเข้ามามีส่วนร่วมนะครับบุคลากรทางการแพทย์จัดในการมุมของการรักษาว่ากันไปแต่ในมิติทางสังคมในมิติทางเรื่องพฤติกรรมการปรับเปลี่ยนพฤติกรรมเนี่ยผมคิดว่าภาคชุมชนมีบทบาทสำคัญรวมถึงเรื่องงานคุ้มครองสิทธิ์ด้วยนะครับคิดว่าเรื่องแบบนี้น่าจะต้องส่งเสริมภาคประชาสังคมให้เข้ามามีบทบาทแล้วก็มีส่วนร่วมมากขึ้นสุดท้ายสุดครับเราต้องสร้างความรู้สึกการเป็นเจ้าของร่วมครับระบบหลักประกันสุขภาพแห่งชาติถ้ามันจะยั่งยืนได้ไม่ว่ากระทรวงสาธารณสุขก็ดีสำนักงานหลักประกันสุขภาพก็ดีโรงพยาบาลทั้งรัฐและเอกชนก็ดีทุกภาคส่วนที่เป็นคนจัดบริการรวมถึงประชาชนครับเราต้องรู้สึกว่าเราเป็นเจ้าของระบบหลักประกันสุขภาพด้วยกันครับมันจึงจะเกิดความรู้สึกหวงแหนดูแลรักษาและปกป้องสะท้อนกันไปมาเพื่อการพัฒนาระบบที่ยั่งยืนต่อไปครับผมนิเทศครับขอบคุณครับ
Thank you, Kun Apiwat, for powerfully echoing the voice of people and reaffirming civil society's commitment to safeguarding the right to health. You reminded us that sustaining USC is not only about financing or service capacity, but also about equitable access, protections from hardship, fairness, and meaningful participation, ranging from board decision to community action. He also mentioned that if we can empower civil society organization to enter and become care provider, not just like the one who decide about the policy. So thank you again for your concise and deeply meaningful contribution. Next, we'll move to the private sector. Okay, may I interrupt you a little bit because Dr. Karine might have to leave first. So yeah, please give her a big round of applause. Okay. Now, Thailand's USC increasingly rely on private providers, especially in urban area like Bangkok. In Bangkok, the NHSO has partnered extensively with private hospital and clinics to expand access, yet the journey has not always been smooth. Dr. Surapot, from your perspective, what prevents us from realizing the full potential of public-private contracting under universal health coverage? And how can we move toward a model where both public interest and private providers can truly thrive together?
Good afternoon. From private standpoint, I would like to stress just few key words. Synergy. We have to work together to be able to be more productive. Okay, next. Actually, sustainable means that we do have enough resources for today, and we will be able to have more resources for future. That's it. Okay. Very, very important, human resources to be able to have an adequate supply to respond to the demand. Okay? And to be the last one to speak is very, very good for me. Whatever I have said, I will not. Okay? Next. Next. We're supposed to be together to be able to work with each other collaboratively. Next. For private, we can help to relieve some congestion and better access. Okay? But with the standard and quality that should be acceptable. Next. Actually, for emergency patients, this is one of the good examples that we have done here and produced very, very good result. Okay, next. To be able to use private sector, we can provide some specialized care referrals or primary care notes that will help. Next. I think the most important thing for health is public trust. If they do trust us, then we have less problem to deal with whatever is undesirable, even with the undesirable result, if we do trust each other. Okay, next. This is just a suggestion that we all, both public and private, we are all national assets. So we should use both more effectively and efficiently. Okay. But for private, we do have to manage our cost. Otherwise, we will not survive. Okay? So be fair. Next. On your left hand is a roadblocks. On your right hand is a bridges. Should we build bridges and recognize that whatever we are facing as a roadblocks, should we have the good solution to solve for mutual interest? Next. Sustainable future. Building the system together, it means that we are working together collaboratively, cooperatively, and productively. So we can expand, we should harmonize, and above all, we should commit with sincerity. The private sector is not just a provider. We are a national asset, ready to serve the public good under effective governance and shared responsibility. That is what we are willing to be part of it. Thank you.
Okay, thank you very much, Dr. Suraput. You reminded that the private sector is not merely an asset, an alternative to public system, but a national asset that can meaningfully strengthen USC by expanding access, relieving overcrowding, and supporting universal quality. You also emphasize that partnership requires not only business consideration, but a commitment to social value in alignment with equity, quality, and trust. Importantly, you highlighted the need to move beyond short-term wins toward a long-term tripartite benefits of people, purchaser, and providers. Thank you once again for your meaningful contribution. So thank you very much for all speakers for your thoughtful and stimulating presentation. As we have very limited time, so I might skip the Q&A session, and then we will move to the summarization part. Excellency and colleagues, today's discussions underscore 5 key insights. The first one is health must be recognized as a long-term investment rather than expenditure. Secondly, sustaining universal health coverage requires transformation, including investment in precision public health, value-based care, and functional ecosystem. Thirdly, a resilient workforce is fundamental to access and quality of care. Fourthly, the private sector is indispensable for expanding capacity and efficiency. And last but not least, the public participation is the backbone of equity and trust that sustain universal health coverage here in Thailand. Excellency and colleagues, if there is one image to carry forward, let it be this: many hands holding one net across sectors, across generations, across nations. This is how we sustain universal health coverage and how we ensure that no one in Thailand or beyond is left to face the river of sickness alone. Thank you very much for joining the session. Thank you. ขอบคุณครับ
Thank you, distinguished panelists and moderator, for the thought-provoking session. I hope both our panel discussions have been successful at providing insights on current sustainable health governance methods at various levels, including the national, regional, and international levels, as well as the interlinkages between them. We also hope that the perspectives on ways forward for strengthening and sustaining UHC shared today will pave way for further deliberations outside of this room. And as Foreign Minister Siasak Phongketkaew said this morning in his welcoming remarks, we hope it will spark new ideas, new partnerships, and new resolve. You are invited to network and enjoy some refreshments following the closing of this event. Please allow us a few moments as we prepare the stage for our closing ceremony. We have now arrived towards the end of the event. May I now invite Ms. Pinsuda Chayanam, Director General of the Department of International Organizations, to deliver the closing remarks.
Swadika, Excellencies, distinguished panelists, ladies and gentlemen, as we come to the close of our event today, I would like to express my sincere thanks to everyone for taking time to join us in celebrating the International Universal Health Coverage Day. As we said from the very beginning, health is a human right, and universal health coverage is how that right is manifested. While we grapple with the multifaceted challenges posed to our global health architecture and to UHC itself, it is important that we remain steadfast in ensuring UHC in the long term. Today, our steadfast was exhibited through the time and expertise shared by our distinguished panelists and moderators. Representing multiple stakeholders and perspectives, they engage in rich discussions to try to answer the question of how we can strengthen global health governance and sustain UHC. I highly appreciate that the discussion tackled the problem from different angles, from how we as member states can ensure UHC's position as a vital part of the 2030 agenda and beyond, to how considerations on health workforce, private sector services, innovation, and people and community-centered UHC can help address UHC sustainability. Excellencies, ladies and gentlemen, it is clear that resolving the complex issues of our current global health architecture, how it is governed and financed, as well as how our national UHC is governed and financed, will take more than one afternoon of dialogue. We need to continue on this path of conversation and cooperation if we want to truly realize health for all and that health is a human right. On this note, I would like to sincerely thank our friends from the WHO, the Embassy of Japan, the Health Systems Research Institute, the World Bank, Mahidol University, the Quality and Standards Central Board, the 9 Sector Network, and the National Health Commission Office for their active contributions throughout our program. And of course, I would like to express my deep appreciation to our partners at the Ministry of Public Health and the National Health Security Office and Thai Health for their great effort in organizing this event with us. Your continued partnership is very invaluable. Allow me also to thank TCELS and the NHSO and their partners for the excellent exhibitions outside. I encourage you to all visit the booths and view firsthand Thailand's policy and medical innovations toward HC before you go home today. Excellencies, ladies and gentlemen, in a few days' time, our colleagues from the health sector will organize the 4th National UHC Conference, which will consider in detail the challenges of UHC financing. The event will be a great opportunity not only to build on the momentum of our activities today, but to also celebrate International UHC Day on 12th December, where UHC really takes root and is being further strengthened at the national level. And with that, I would like to close our event. I thank you all once again for your kind participation and wish you all good health. ขอบคุณค่ะ
Thank you very much, Director General, for your closing remarks. And thank you once again to all our partners, panelists, moderators, and participants for joining us today. We hope that the discussions have been insightful, thought-provoking, and inspiring. We now invite you to enjoy the refreshments we have prepared outside, explore our exhibitions, and take some photos at the photo booth. Lastly, we have a small token of appreciation for our guests available at the registration table. Please don't forget to take one before you leave. และสำหรับท่านใดที่ได้ยืมหูฟังไปขอความกรุณาโปรดคืนที่จุดเดิมด้วยค่ะขอบคุณค่ะ Thank you and a very good afternoon to you all สวัสดีค่ะ